Hi, thank you for watching Digging to China. I'm Dong Xiang. Some people with COVID-19 continue to have lingering symptoms for weeks or months after they begin to recover. Experts have coined a new term for it, post-acute sequelae SARS-CoV-2 infection, or simply known as long COVID. Research says about 10% of people with COVID-19 get long COVID. It can happen to anyone, whether you are young, old, healthy, or have chronic illness. You can get it even if your early COVID-19 symptoms were mild to moderate, or regardless of whether or not you went to the hospital for them. The symptoms are fatigue, brain fog, loss of smell and taste, short breath, cough, joint pain, chest pain. You might also have sleep issues, anxiety, gut problems, fever, muscle pain, depression, headache, rapid heartbeat. According to a large study at the Imperial College London, the majority of people with long COVID report fatigue as the dominant symptom, alongside muscle aches, difficulty sleeping, and shortness of breath. According to a white paper from Fair Health, nearly 25% of patients who tested positive for COVID-19 experienced post-COVID symptoms 1 month after infection that they did not have previously, including a substantial number of patients whose COVID-19 infections was mild or asymptomatic. For the study, researchers looked at health insurance data on nearly 2 million people who had tested positive for the coronavirus between February and December 2020. The database included only those with private health insurance or Medicare Advantage. According to Fair Health, the study has not been peer-reviewed, but it was evaluated by an independent academic reviewer. Many of the most vulnerable are among younger people who are not vaccinated. It affects between 10 to 30% of people who catch the virus, including those with mild or asymptomatic infections. In some cases, symptoms persist for more than a year. The best prevention of long COVID is not to get COVID-19 in the first place. In the US, cases are rising as the states relax restrictions and the highly transmissible Delta variant spreads. Priya Dugal is a professor of epidemiology at the Johns Hopkins Bloomberg School of Public Health. She said, "Long COVID is real. Now we have a whole group of individuals who have survived COVID who are going on into a chronic long-term state that will likely be with us for a really long time." While it's clear that people with certain risk factors are more likely to have a serious bout of COVID-19, these risk factors include high blood pressure, smoking, diabetes, obesity, and other conditions. However, there isn't a clear link between these risk factors and the long-term problems. In fact, long COVID can happen in people who have mild symptoms. The issue of long COVID is serious enough that governments have poured large sums into research. The National Institutes of Health has committed $1.15 billion over 4 years for investigating the conditions, while its UK counterpart has provided $54 million to fund the research investigating causes, diagnostic methods, and possible treatments. Researchers suspect that the long COVID likely comprises several overlapping conditions with different causes. Among the leading theories are that the virus triggers some kind of autoimmune condition, that it causes lasting physical damage to various organs, and that the virus lingers in the body long after infection. Already, there is some breakthrough. A team from the Max Planck Center of Physics and Medicine in Germany used a technique called real-time deformability cytometry to examine thousands of blood cells from both COVID-19 patients and healthy individuals. Those tests revealed the size and deformability of red blood cells differs greatly between those contracting COVID and those who have not. The real-time deformability cytometry allowed the researchers to send blood cells through a narrow channel at high speeds. This process also stretches both the red and the white blood cells which pass through, while a high-speed camera records each one with the aid of a microscope. When this is complete, custom computer software goes to work, determining how big and how deformed each cell is. In this study, researchers examined the blood of 17 patients with a severe case of COVID-19, 14 people who had recovered from a COVID infection, and 24 healthy volunteers. The drastic changes in the red blood cells between infected and uninfected individuals points to damage among COVID patients that could put them at increased risk for blockages and blood clots in their lungs. Results show the ability of a COVID patient's red blood cells to carry oxygen appears to be impaired. Researchers believe this type of blood analysis could be key in future COVID-19 examinations, as well as acting as an early warning system during future epidemics involving unknown viruses. There is no proven treatment for long COVID, although researchers in the UK are conducting clinical trials to establish whether widely available anti-inflammatory drugs such as aspirin, gout treatment, gosochin, and antihistamines could cope. Louis King is a medical director at a COVID recovery clinic run by the University of North Carolina at Chapel Hill. He often tells patients there is not a magic bullet that is going to cure them. He said, "We just don't know much about it. In the meantime, you, my audience, just don't get infected with COVID." Thank you for watching. Please leave a comment and subscribe to my channel. Just click the subscribe button right here. I'll see you again shortly.